What's going on, guys? This is Specialist Lee back on Steadfast Courage. So today I got something cool, interesting. I've been thinking about video ideas and this one came up to my mind. IFAK. IFAK is an acronym for Individual First Aid Kit, and I've featured it on this channel once before, but this is going to be extreme featurette. It's on my gear. Pretty much is on my right side. It's this giant pouch. It's like a medical kit for those situations where you're shot, injured, all kinds of injuries can occur. These are specifically made for specific situations, like bad injuries, getting shot, getting cut open, life-threatening injuries. I'm not talking about little band-aids, you don't need little band-aids, but you can also stash little band-aids in here. That's not a bad thing. And pretty much this is what all this is for, and we're gonna go over what should be inside of IFAK and the training that is required to use such a piece of equipment with all these items in here. So let's do this. Remember to like, comment, subscribe to Steadfast Courage. And we check out the other videos, man. I got a bunch of other videos. Check it out. I need the views, baby. Just check out the other videos. I'm gonna leave a link here for my last video I made. Just check it out. Alright, let's get to it. So this is my IFAK. You can put this on your vest, like I said, on the side of me, or you can put it on your battle belt. I don't like it on my battle belt, but shooter's preference, you know what I'm saying? So this IFAK is from 511, or you can get a simple IFAK pouch like so, ACU pattern or OCP pattern. And there's multiple different types of OCP type IFAK pouches you can get. Just go on the line, sky's the limit. But mind you, every IFAK is designed differently and to deploy differently. So this IFAK is made to be deployed with a zipper. You zip this bad boy up, zip that greasy pig open, bam, bam. We got a marker right here, and we got these zippers here for different individual pouch locations. With this mesh on the side, really just ties the room together, man. Ties the pouch together. So what I got in here is a tourniquet for your limbs. Make sure you practice tourniquets. I got shears, rubber band, chest seal, trauma dressing, tape just in case the seal breaks on your chest seal, gauze, tourniquet, another one for them tight spots. You always need extra tourniquet. SWAT T tourniquet, self-care. We also got hemostatic gauze. You always need hemostatic gauze, and that's one side, and that's one side of the pouch right there. It holds all this stuff in one side. I got pre-lube nasal airway. This tube has little directions right there. We'll go over that in a minute. Extra marker, just in case the other marker breaks. Tactical combat care card. With this card, you use it. Look at, as you can see, you got a whole person drawn out right here, rear and front. So with this one, you can mark the time, the name of the patient, any allergies, any injuries, mark on here. Let's say you got a gunshot wound to the abdomen, or your leg is blown off. You write down anywhere on here, time and when it happened, or when to apply a tourniquet right here, time. Let's say you got 4 tourniquets on a person. Let's say you got 2 tourniquets on one limb, one high, one low, so the person doesn't bleed out bad. Always good to have 2 tourniquets and one blowing off or one blowing off limb. We got the time that you put on the tourniquet, make sure you mark that. And if you're actually a medic, you got blood pressure, respiration, plus and all that good stuff. I don't know much about some of this stuff. The pain scale, AVPU, I don't know what that one is. I'll be honest. I'm not a medic. I'm just a grunt. I just know what to do when you get shot. Make sure you pack it with gauze, and make sure you stuff it with gauze, or apply a tourniquet, or apply a gauze and a tourniquet. So we got emergency trauma dressing. We got rubber gloves. And we got a needle for chest decompression. We're gonna go over this tactical combat casualty card. Alright, let's do this. We got the IFAK. Is it urgent? Is it priority? Is it routine? Time and date. When you got injured or killed, or injured. Which would be the date, what day it is, the time, which could be 1800, the time of the day. It could be multiple things. Your name, male or female, sex, allergies, and your ID number. Mechanism of injury, you write an X, whether it was artillery injury, or blunt force trauma, burn, a fall, like you fell, grenade, or you got hit by a grenade or something, took shrapnel, GSW, IED, landmine, MVC, RPG, or other. It has all these things right here. Or you could just write down right here as other. You got hit by a car. You know, you never know what could happen. And if you, let's say you get shot. So we got this little man right here that represents the person. So let's say you stepped down a landmine, you blew off your right leg. We're probably gonna apply 2 tourniquets on you. One of these bad boys. Then we're gonna put one high and tight tourniquet around your thigh, and we're gonna put one probably just above the injured area, or probably not, either one. Depends on the person. If one tourniquet's not enough, you can apply another one. Then you put the time that you applied the tourniquet. What I've been told was that once you apply a tourniquet, you can last 6 hours before the limb goes dead after the tourniquet's applied. Let's say you're in a tight spot.
Damn, we're in a tight spot. Damn.
Overseas, you get shot, or you're here in a tight spot, get hurt out in the middle of nowhere. This is good to have, whether it is you're stuck out in the middle of nowhere, or you're injured overseas. Pretty much this applies either way. You can use this card. So pretty much, if you actually know your stuff, let's say you're a medic, or you're a doctor, you're out in the middle of nowhere, you actually know and you have your medical equipment. You can check pulse rate, location, time, blood pressure, and your time, respiration, time, pulse, O2 at setting and at movement, time, AVPU, I don't know what the hell that is, I'm not a medic like I said earlier. Scale pain from 1 to 10, 0 to 10, and time. So pretty much what I've been taught was like, you want to make sure you fill this out every hour on the hour. That way you got it up to date within 4 hours right here. It shouldn't take 4 hours to get medevaced out or get to hospital. I hope not, unless you're walking. But you should be able to make it within the 4 hour time limit. Alright, we got the back. So the back of this card is pretty straightforward. We gotta mark any one of these boxes with X's on what is important, or what is applied, or what the patient is. So you got IFAK. What type of IFAK is he? Is he urgent? Is he priority? Is he routine? Urgent would be something like he got a bullet wound to the head and he needs a brain surgeon to save his life. Or all his leg is blown off and you can't apply a tourniquet. Only thing you can do is pack the wound. Or priority, he has a gunshot wound. but he's still able to walk around and move around. Let's say you got a gunshot wound to the arm, he can still walk around, he can still breathe, he can still talk. Routine, he'd be sick, he got a boo-boo or an owie, and he's all fine and dandy. We don't need to hurry up on that one. Unless he's pooping his guts out, then he still would be priority. Now, the treatment of a tourniquet, applying the tourniquet. So, CAB. So we got extremity, which is pretty much applying a tourniquet to the leg or arm. Junctional, which is applying a tourniquet to, let's say here, right on the shoulder, or right on the thigh, right there. That would be junctional. You put there. Traumatical would be nerve damage or something like that. That one's really weird for me. Or dressing, where you just stuff the wound with dressing. Hemostatic is you gotta know what you're doing to apply hemostatic. So hemostatic would be on like a, let's say you got a gunshot wound right here. So applying hemostatic dressing or hemostatic tourniquet, would it be necessary to apply hemostatic dressing here? Or would it just be better to apply a tourniquet here or here? So hemostatic is very interesting when it comes to that. When it comes to this card, or in general, hemostatic would be applied to the torso or down in the crotch area, or where you can't apply a tourniquet. Or would you apply hemostatic on the arm? It all depends on the wound. Let's say the wound is not that bad, but it's still bleeding, but you can also apply hemostatic dressing or hemostatic tourniquet, which is not tightening the piss out of the tourniquet. You're just wrapping it pretty much with gauze. Now pressure, if you just applied pressure, just stuffed it with gauze and pressured it, you're fine and dandy. You mark that X. Or other, I don't know what other would be, I'm not a medic, so we'll go from there. Alright, A, intact. So pretty much intact means what the word means, intact. Nothing's going on, nothing's happening, so you're fine and dandy. So you want to X out of intact. Or NPA, which is Nasal Airway, which is this. You stuff that in the nose, I think it was the left.
The NPA is a flexible tube consisting of a flange at one end and a bevel at the other end. When inserted, the bevel should be oriented towards the septum. To ease insertion, the provided lubricant should be applied to the NPA. If lubricant is not available, the casualty's saliva or blood may be used. Lubricate as much of the tube as possible. To insert the NPA, ensure the bevel is to the septum and gently insert. Notice the medic is not orienting the tube towards the top of the head. Instead, he is directing it almost straight back towards the back of the head. If resistance is met, it may be necessary to gently rotate the NPA. If the casualty still does not accept, attempt the other nostril. The NPA should be inserted until the flange is touching the nose.
It's the right nose, your right nostril. You stuff it in, usually helps with the breathing. CRIC, which is a tracheotomy tube, which is one of those things where you just, it's disgusting. I don't think you want to apply a tracheotomy tube. I sure hell wouldn't.
PCK cricothyroidotomy kit. This is a wide-bore cannula over needle device. The neck should be cleaned with an appropriate skin solution and the area prepped as a sterile field. This sequence shows cricothyroidotomy using a Portex PCK cricothyroidotomy kit. This is a wide-bore cannula over needle device. Following identification of the landmarks on the neck, a small incision is made. When pressure is applied to the tip of the PCK needle, the red flag indicator near the top becomes visible. This can help to identify entry into the hollow trachea and also when the needle touches the posterior wall of the trachea. The red flag is visible as the needle presses against the cricothyroid membrane, but then disappears as the needle enters the hollow trachea. On touching the posterior wall of the trachea, the red indicator becomes present again, At this point, the PCK should be withdrawn slightly and the needle removed. The trocar can then be removed and the cannula slid into the trachea as shown. The cuff can be inflated and the device connected to oxygen or capnography.
If the patient needs that, you apply a tracheotomy tube. The ET tube, which is the endotracheotomy tube, which is just the tube you stuff down the throat. It's disgusting. I don't want to do it.
Hi, this is Almira Oosthuizen with Cape Town Emergency Medicine. Today talking about correct insertion and use of a laryngeal mask airway or LMA. An LMA is a supraglottic airway that can be used for the non-definitive management of the airway or as part of a difficult airway management algorithm. The first step in using an LMA correctly is to select the correct size. Sizing of laryngeal mask airways are manufacturer specific and the instructions will usually be printed on the tube itself. In this case, we can see that it would be appropriate for an adult weighing between 50 and 70 kilograms and that the amount of air needed to inflate the LMA cuff is 30 milliliters of air. Before using the LMA airway, make sure that the cuff is fully deflated and that there is no further air in it. Once the cuff is collapsed, the next step would be to use a water-based gel lubricant to lubricate the back of the LMA device. It's important not to lubricate the airway or front as gel may obstruct the airway. Once the gel has been applied to the back, consider spreading it gently and evenly around. To insert the LMA into the patient, make sure the airway part of the LMA points towards the lungs or feet of the patient and then gently insert into the mouth. It may be necessary to open the jaw slightly. Then with firm but controlled pressure, slide the LMA until you feel it seating in the pharynx and the supraglottic area of the patient. At this point, we would select the amount of air, 30 milliliters as indicated on the tube, and inflate the LMA cuff. It's important not to touch the tube itself so that the LMA cuff can seat itself anatomically without interference from outside forces. As we inflate it, we can see the tube seating and we confirm good pressure in the pilot cuff bulb. One would now ask an assistant to secure the tube with their hands while attaching a ventilation device, in this case a self-inflating bag valve device. Ventilate the patient and confirm chest rise and also listen into the epigastrium to see if there's any gurgling of air. At this point, you would secure the LMA to the patient and continue with your ventilation strategy. And that's it, correct insertion and use of an LMA.
The SGA, which is supraglottic airway, which is pretty much a tube you stuff down the throat as well. I suggest not doing any of these if you're not trained in the way of the medic way. I suggest that you do not do any of these things. I won't even try any of these things besides the NAP, which is the nasal airway gel or nasal airway. That's the only one I would ever try. CRA, yeah, I won't even do the tracheotomy. Hell no, that's crazy talk. Okay, B, Bravo, which is O2. You have O2. Are you breathing O2? You got him hooked up on air. This is pretty much about air. Bravo's air. Pretty much the next line below it is fluids. Did you get an IV? Is it saline? Or if you gave him blood, him or her blood, what type of products? Whose blood, what time, volume, how much? Volume is how much blood did you give? Is it routine? And what time? Okay, last, in the middle, meds. Right, it says right there, meds. Analgesic. Did you give them morphine, ketamine, fentanyl, any one of these painkillers? You write it right here. The dosage, the amount. Is it routine? And the time. Make sure you have all this stuff written down. The time is important. Antibiotics, did you give them any antibiotics whatsoever? Or some other type of medicine? So last one last but not least, combat pill pack, ice shield, left to right, or splint, hypothermia prevention, which is one of those bags you wrap around the person, the individual. And make sure you write first name and last name of treatment guy, your first responder right here, which would be me, Specialist Lee. So that's pretty much the whole card, which is pretty intense if you ask me. It's a lot to know, a lot to learn. Just this small amount can save a person's life. Let them live on, enjoy living, you know. And a good way to get good at any one of these, this equipment, is either research it on your own, which is good to know, to research it, but you won't have it hands-on if you just research it. You really need hands-on with this type of equipment. You need like a medical professional to show you how it's done and know like the ins and outs of a human body, just in case you screw up, because they can go through a lot. I really don't know where to get this kind of training from. Maybe there's a place that you can pay for. I'm not sure. I've never heard anything about it. But I do know an organization that does train you and actually pay you to learn this. The Army. Alright. Either join the Army, active duty Army, the Army National Guard, or the Reserves. But make sure you go with it. If you're gonna do Army in general, I'd go with infantry if you want to learn any of this stuff. Because infantry teaches you all about this stuff. Everything about it. I'm just a simple grunt and I know pretty much the basics of the human anatomy. If you get shot, how to treat an individual, how to take care of them. They taught me a lot of stuff, alright? Especially if you have good leadership, or if you become a medic in the military. I'd go with infantry because infantry is more fun. I don't know about being medic, but I know infantry is a lot more fun. Plus, they make movies about infantry. You don't see movies about truck drivers or any of that, but remember that. The Army is where it's at. They can teach you all about this stuff and you get paid to do it. So there you go. We went over what an IFAK has and what my IFAK doesn't have. Pretty much all life-saving piece of equipment an IFAK should have is what we went over. And the IFAK I have can do pretty much almost all of it, but I found some weaknesses in what I need to do with my IFAK. But make sure you do the same for yourself. Make sure you figure out how to use this equipment. Practice on wrapping your own tourniquet on your leg, and make sure you practice with others, because I swear to God, this little piece of equipment can save your leg. It can save your life. I'm telling you, it's very important to have one of these, even just on a day-to-day basis. It's not something that you should just think, oh, that never happened to me. Swear to God, that's why you have guns. Just in case something bad happens to you, it's always something to fall back on to protect you. And the same as a tourniquet, something to fall back on to save you. Same with any one of these pieces of equipment. It may save you or a loved one, or save a stranger. You never know. It's always good to have excess of everything as well. Just because you have one doesn't mean you can just leave it as one. Always have excess of everything. Whether it is one pistol, 2 pistols, 10 AR-15s, always have extra of everything. You never know when it's going to save your life or save others. I swear to God, that's truth. And make sure you like, comment, subscribe to Steadfast Courage. And I hope you enjoyed this video, because I enjoyed making it. And make sure you check out any other videos, on Steadfast Courage. There's so many videos. I got 83 videos on this bad boy. Check it out. Again, Grunts on the Guns. Check that out. I like to thank my parents, my family in general. They really help me out on this channel all the time. I really like to thank them. Remember, peace through fire is priority. Specialist Lee out. And remember, vote Republican.